Welcome to TrulyFit.
LeNae, thank you so much for joining the TrulyFit Podcast. Why don't you give my audience and listeners a little background on who you are and what you and your company do in the health industry?
Yeah, well, thank you so much, Steve, for having us on. And I say us because I'm hoping Dr. Goolsby will be coming in any moment. But yeah, so we're the founders of Infinite Health Integrative Medicine Center. We have two offices in the state of Louisiana, one in the New Orleans area, one in Lake Charles, which is right about 20 minutes from the Texas border. But we have clients that are across the nation. Basically, we focus on, like you said, health optimization, longevity, and regenerative medicine. It's a mouthful, but all those good things. By way of just giving you some background about who we are, my husband, Dr. Tripp, is actually a board-certified medical oncologist and hematologist and was in private practice providing chemotherapy care for probably over 30 years. And about a decade ago, we actually transitioned out of providing cancer care and completely into the integrative medicine approach space. So we've been doing this for about a decade now. I have been managing his practice since we got married. I was voluntold. So that's kind of how I ended up here. I like to say I'm a displaced lawyer, having graduated from Tulane law. But so that's kind of that's the redux on the educational component. But yeah, so we got into providing health optimization about a decade ago, like I said, and basically for us, that's taking what we call a multi-pillar approach to looking at somebody's current health status, getting them to conceptualize what their happy end result is, and then tailoring a program specifically for them to get them from where they are to where they want to go.
All right, so let's talk a little bit about your patient experience, and I'm sure it's going to vary, but that's really what I want to talk about. Is the average person coming in with one particular issue, like, oh, I have this sort of pain, or oh, I'm looking to do this, or are they coming to you from like a more, I guess you would call it, holistic approach, saying, hey, I'm just looking to be healthier and live longer, what can you do for me? And then you guys kind of write out a prescription based upon that.
Yeah, I mean, it really runs the gamut. I think, as in America, we're really acutely from a health perspective of what we don't want. So a lot of us don't take action until the pain becomes unbearable and change seems better than the pain. And so we do have patients who are like, this is my year of yes, I'm going to take care of myself and really do whatever I need to do to feel younger and healthier again. And then we might run into people who have got multiple chronic issues, stress, anxiety, depression, chronic pain and inflammation. A lot of hormonal imbalances. Those symptoms present themselves in various ways. So people are coming in with, insomnia or unexplained weight gain, or it really kind of depends. Then we have patients who actually come in for a holistic approach because they intuitively know that there's something wrong with them. They don't feel the way that they think they should feel. But maybe out in the traditional healthcare arena, they've been told they're normal, or they're treated like a number, or they're not getting that attention that they desire. And so a lot of patients will find us because they understand that what traditional reactive approaches to medicine are no longer working for them. And so we provide a different approach.
Okay, so tell me a little bit more about your model in comparison to everyone else. Or do you feel like you have a lot of competitors? Are you guys unique to the scene? Is this becoming more of a new thing? Me looking at this, my wife is a physician, and it seems like this isn't a specialty that somebody goes and studies through residency, right? That's hence the integrative medicine term. You're taking a bunch of different specialties or subspecialties and putting them together. Is this a new fad? Is this a new thing that's going to be popping up everywhere? Or do you guys think that you're really just kind of new to the scene?
Well, I think integrative approaches is not new. They've been around for years. I think the word integrative is kind of trendy in healthcare space right now, and a lot of people use it liberally. I have a very strict definition of what integrative medicine is. I learned it from Dr. Adam Perlman at Duke University Integrative Medicine Leadership Development Program. And so for us here, Integrative Medicine is a proactive approach to care that places the patient in partnership and looks at all those factors that affect health. So emotional, mental, physical, nutritional, environmental, right? For us specifically, what we do is we look at the best of traditional approaches to care, and then we integrate those in with the best of peer-reviewed and evidence-based complementary therapies. And like I said, we have a multi-pillar approach. So when a patient comes to us for whatever their malady may be, we're going to immediately get them to start shifting the way that they're thinking about their challenge, if you will. So, like I said, they know what they don't want. They haven't conceptualized what it is they do want a lot of the time. So the first question is, okay, here's your intake paperwork. Here's, your history, and this is what you're experiencing that you no longer want to experience. But what does the flip side of that reality look like to you? What is your happy end result? What does that feel like? What would you be doing in that scenario that you're not doing now? So really getting them to start thinking about what it is they want. And so from the way that we approach things and our multi-pillar approach really niches us out. Our parameter for what we're looking for creating that optimal health and age reversal status is a really strict parameter. So for example, in other practices, in the traditional setting, they're looking to see if you're normal because they're looking at the bell curve of what's normal for your age and whatnot. But that's not a really good indicator of what that person needs. So we're looking at a 1 of N or an N of 1. I always say it wrong. And we know through epigenetics that we can actually reverse the disease and the aging and the inflammation status to get that person back to where they were when they were at their prime. So from a competition perspective, I don't really look at competition. I'm a little egocentrical in that way. We're in our lane. We're doing what we do. We're getting the results, that I think are pretty good. So I don't worry about competition.
Yeah, and that bell curve and those parameters, there's a problem in those. I'm certainly no expert in hormones, but I do know about male hormone therapy. We're going to get into female hormone therapy in a second. But, if you go to the doctor, they'll take a range, and typically for males, like your free testosterone will be somewhere between, let's say, 200 and 900, right? But I could feel great at 250 and someone else could feel terrible at 850, right? So it doesn't necessarily mean what else is going on. How is it being used? How is that? There's more factors than just a quick snapshot of a number and what's going on. And I don't think the average person knows that. And because the average physician is not letting that on to the client and patient, I'm sure you guys will talk a little bit about that now leading into it. What sort of lab work do you do when we're talking about these hormone therapies, and I don't know anything about female hormone therapy, so if you want to kind of unpack that for me, that'd be interesting.
Yeah, for sure. We have a very comprehensive lab panel that we have. I know when we first started sending it out to LabCorp and Quest and whatnot, the techs over there were like, oh my God, this guy's asking for all these blood. And the patient's like, oh my God, I was there and they took all these vials of blood. So it is very comprehensive. Really don't want to go into what it is because it's proprietary, but it is very comprehensive. And when we're dealing with somebody who is getting hormone replacement therapy, we're looking at those labs at least quarterly, sometimes 6 to 8 weeks a year, because we want to make sure that we're getting the right dosing and that things are fluctuating, and it's all very experiential, right? Is it serving the patient or is it not? Do we need to tweak it or whatnot? So it is a very comprehensive panel for sure. And I think that's, one more thing that sets us apart, because I hear stories all the time about people going and getting, pellets or injections. A lot of guys, had a guy in yesterday actually, who was on testosterone therapy, and he wasn't getting his labs done, but maybe once a year, if even that. And he was left to his own education on what his dosing was. So, not a good way to do that. Yeah. So.
Yeah, I've heard horror stories as well about guys who are on it, or maybe they're on like an AI, some sort of aromatase inhibitor to slow things down, and it didn't work well with them. But there was no second step. They weren't like, well, what can we do? What's the next step? They're like, well, tough. This is it. We have one particular way in which we go about this. If it doesn't work for you, you have to go somewhere else, where other clinics would use, let's say, HCG, or just try a different AI, or work with the patient to say, hey, ultimately this is about you feeling great, and it doesn't matter what the numbers say. If you're telling me that you feel bad, we're gonna change this concoction up.
Right, for sure. I think looking at values consistently is very important, especially when you're on hormones. And for women, I think, we have a lot of women who, if you're over 30, your body's not making hormones like they did before you were 30. It's just life. But we know how to get those levels back up to where they were when you were peak. And so for a woman, symptoms may be, like I said, unexplained weight gain, insomnia. She's cranky. She has a low libido. She's stressed out at work. All these symptoms may be an indication of a hormonal imbalance. So when that woman is coming to us, we'll send her off to get that very comprehensive panel of labs back. And then at that second appointment where we're going through that lab review, we'll go, okay, well, this is your history. These are the things you don't want. This is what has come back in the lab panel. This is what you say you do want. And so now we're going to go through looking at, the nutritional component. What kind of foods are you eating? Are they foods that serve your goal or not? Are you exercising? What is it that you can do that you would love to do? Because if you hate to run, don't run. You're not going to be successful doing that, right? So let's find something you love. And then we're looking at the bioidentical hormone therapy component, which may include nominal testosterone for a woman, estradiol, progesterone, thyroid. Most people are thyroid hypothyroid. So all of those are taken into consideration, and the dosing, it really is dependent upon what serves that patient in that moment. So everything we do is very tailored to that patient. And then all of that is tied to our proprietary mind-body coaching program. So.
Yeah, I mean, I'm going to go back to something you just said before about adherence to the program. If they don't like to run, we're not going to tell them that running should be a part of it. But I also like how you're integrating all these things in, because it doesn't matter if all of your hormones are perfect and you feel great, if you're not taking advantage of that by exercising, by eating healthy, right? If you're still just laying around on the couch and watching Netflix and and eating ice cream, like you're wasting your money in a sense, right? Like why go to the physician, get everything optimized, only to then not take advantage of your body? And I think not everyone has probably taken that holistic approach. Most people are not. I think if you go to your average, let's call it like hormone therapy clinic, they're just looking at a number, a panel, they're sending you home with the medicine, and that's it. They're not looking at any other aspect of your overall health and wellness, where you guys seem to make sure that you're looking at the full scope and the full spectrum of their health.
Well, it is very we're very goal oriented, like what is your happy end result? So I think that's so important. And I think that might be a missing element in, traditional or other approaches is, okay, here's what might be normal for you, and we're going to get you normal, and good luck with that. Here's your vial and here's your syringe.
Yeah. Yeah, unfortunately, that's the way most of it is handled. But I'm glad to hear that you guys take not only the next step, but the next 3 steps and go above and beyond. I saw that you guys do some sort of nutritional infusion related thing. You want to speak to a little bit about that, whether it's the ingredients or maybe when you would use that as opposed to when you wouldn't use that? Do people come in and ask for that specifically, or is that like a part of a larger package?
Yeah, so, well, both. We do have people who are familiar with getting the IV infusions, and so they will reach out to us directly just for that component of care. Maybe they're not, maybe they're younger and they're still burning their telomeres at both ends, so they have got nothing to lose, but they went out and had Mardi Gras all weekend, and so they need to refresh the hydration. So we do have that clientele. When we're looking for if somebody's come to us and they're really focused on reversing their aging process, it may be something that we include in their package, because we can actually do some really exciting things now with exosome infusions, which are really cool and really helping people to reverse that aging process, and we can actually track and measure that. But generally, if somebody's looking for hydration or if they're looking to boost their immune response system, We can do high dose vitamin C infusions. If they're looking to feel more vibrant or eliminate wrinkles, we've got, beauty cocktails that we can mix together for them as well. So it really kind of, once again, depends on what the goal is for that patient as to what kind of concoction, if you will, that we'll put together for them. And I think Trip has decided to join us. So
welcome, Trip.
Right. So how I conceptualize and use IVs is not kind of like you come in after you're hungover and stuff.
well, I
like
told
that
him we do
either.
have patients that do that,
Sure.
particularly since we just got off of Mardi Gras.
But the real thing for me is using the IVs as a means of metabolic enhancement for people who and to choose the metabolic pathways to enhance. So, for example, somebody needs more ATP, or they have maybe they have a little anxiety or depression disorder. That generally correlates with a number of neurotransmitters that can be enhanced by using specific amino acids and things like that. So I don't use the IVs as I use it every day for, give vitamin C and this and that and the other. I use it as a complement to the optimization program that I do with the patients. So
I was telling him we were also doing some really exciting things with exosome infusions as well.
Right. Yeah. So there virtually all of the end organ diseases that result from, for example, diabetes or atherosclerotic disease, renal failure, liver disease, pulmonary disease, traumatic brain injuries, strokes. All of these things really benefit from actually repair, and we have the means to do that. We thought maybe 15 years ago that the stem cells were the way to go, because the stem cells, we thought that they actually transformed themselves into the organ cell that needed to be replaced. But in fact, subsequently, we found that there are these little particles inside the stem cells that contain all the growth factors and the cytokines and all of the really interesting stuff that activate the pathways to create new cells, to create repair and things like that within the body. And virtually every organ system at this point, at least experimentally, if not in human use, have demonstrated significant repair capabilities of these little nanoparticles that are called exosomes.
Are you using that in the joint related issues as well, joint inflammation?
Yeah, that's kind of where I started, actually. But so the musculoskeletal stuff, it repairs the cartilage, repairs the ligaments and tendons, repairs the bone, repairs the nerves, repairs all the connective tissue holding the joints together. Just fascinating stuff that actually I've had huge success over the last 7 or 8 years with it. So it's been a real eye opener. And so my philosophy at this point has kind of evolved into optimizing all the pathways, all the metabolic and repair pathways to set back the clock and make people that come in virtually wheelchair bound, getting them up and getting them active again and getting them back out doing the things they love to do.
So you don't have like one just generalized banana bag. You're looking at the person and you're taking the labs, which are extensive, and you're saying, okay, you need whatever, 5-HTP, and you need vitamin D, and this is what you need, and we're going to put this together for you, and what you don't need is X, Y, and Z. You do need A, B, and C, and you're making sure that it's very personalized.
Yes. And, I start everybody that comes in with I'm not sure if you're familiar with the epigenetic aging test that's out there.
I'm not.
It's a fascinating test that was developed, probably became available to the public maybe 4 or 5 years ago. And basically it looks at the degree of shutdown, methylation of DNA, of our DNA. There are about 20 million sites, a few. And basically the methylation and the shutdown has been correlated. There's a correlative graph that actually tells us is linear and correlates with our exact biological age. And so I've been using that test on my patients for the last couple of few years, and we've had some just amazing results just by doing the optimization process, not even using the stem cell stuff. We do the optimization process, and we get anywhere from 10 to 20, 25 years biological age regression. And it's just, it's been so gratifying. And you see that in the patient, the energy and the vibrancy and their focus and their ability to be more competitive either in sports or be more effective in the workplace. It's just been an amazing thing that, and it correlates with age regression, and so lengthening of biological life.
Do you deal with, I guess you would call them like movement disorder patients, sort of, let's say like a Parkinson's-esque issues where people coming in, is that some of the stuff that you guys do shown to help that, if not necessarily reverse it, but stave it off?
Yeah, doing one today, actually, doing a Parkinson's patient today. So, and I'll use a combination because NAD has been proven effective somewhat in the Parkinson's disease arena. I'm going to be using that plus the nanoparticles in a nasal and an intravenous infusion.
I asked LeNae this before, but I'll want to get your take on this. Obviously, having integrative medicine, that term could be a loaded term. People describe it differently, but you guys are a bunch of different subspecialties put together. Will this ever just be one specialty? Will you be able to go, let's say 20 years from now, into residency and take the proper courses so that you can come out and do exactly what Dr. Tripp does?
So the thing is, right now, it's kind of separate, as you probably know. The musculoskeletal, PM&R, physical medicine and rehab domain has and orthopedics and physical therapy, kind of the prolotherapy. All of those techniques have kind of started out with the very early on using the prolotherapy, which is short for proliferative therapy, to make the joints and the ligaments, make those cells proliferate and repair. And so that was kind of one part. But now, as we've isolated the true cause of the benefit from prolotherapy, we know that the stem cells actually, and that goes through that chronology that I discussed, the 15 years ago or so. We thought it was the stem cells converting themselves into the cells that needed to be there to repair and that, but they don't. It's actually the exosomes communicating and changing the resident stem cells and activating them, shutting down the inflammation that prevents them from working, and then putting them back to work. So all of those things, it's kind of dispersed right now. And my philosophy as I moved out of oncology and into this was, well, first I started with the optimization process. Then I added on to the musculoskeletal component, with my philosophy being I want to address this with the making our body do the work, because it's a fantastic machine. Make the body do the work, and then and do a repair instead of covering over the symptoms, so to speak. So we let the body do the repair, and that has evolved into all of these other end organ arenas. And in my mind, if we can continue to repair the damage from how we live, basically we get that result, and we can not only increase our health span, but we actually increase that quality of life that we have even as we get older. So
the question was, in 20 years,
will it be a subspecialty?
will people be able to?
As she was going over the questions, I said, I really wish we could put it together in one thing, because I think that biological approach, making the body work, maybe it's just going to be called medicine.
One would hope that there would be, it seems like everyone is subspecializing and continuing to go into these specialties rather than what you're doing, putting them together and saying, well, we have to look at some of these things in conjunction because they all work together, right? That's how the body works as one. Can you talk a little bit more about the joint pain? I guess I would call it like your average client or patient who comes in with joint pain. Are you talking about people who are weeks away from potentially getting a joint replacement, or somebody who's just maybe running too much and having some small joint related issues? What sort of level of joint issues are we talking about?
So I've got the entire gamut. I've helped people from one example is a fellow that came in while I was doing prolotherapy and PRP early on, before I was even doing the stem cells. Had a place up in Aspen. His family would go up to Aspen. He traveled the world selling antiques, and basically he was in town. And I said, well, why are you here? Why aren't you up skiing in Aspen? Because he was an avid skier. He says, well, I can't ski anymore because my knees hurt. I do one run, I do a blue run, and my knees are in so much pain. And he wasn't having problems with day-to-day walking and doing all that. But I said, look, what that tells us is that you're creating inflammation, and that inflammation, we know that osteoarthritis can evolve very rapidly in that type of setting. So I said, why don't you let me do your knees, and we'll see how it goes. And he's well off, so he said, okay, let's do it. And I did it, and then he kind of got lost to follow up after the next visit, and I guess. He came back about 6-8 weeks later, and I asked him if he had been overseas, and I said, "Oh no, I've been up in Aspen skiing and doing all this stuff." And so it was very successful, and to this day he's starting to have. This is about 3 or 4 years later now. He's starting to have a little bit of discomfort, and is thinking about re-upping, But this is the type of thing, starting early in like a runner or somebody who's very active in sports, can preempt the development of bad degenerative disease in that fashion. And so those people that are aware of the technique and its benefits, I highly recommend try and start things early. At the other end of the scale, I have people with bone on bone come in with bone on bone. They're weeks away from their total knee or hip or other things, and I'll use probably a little bit more aggressive approach in those patients. And with multiple sets of injections, but the results are virtually the same. Decreased pain to no pain after 3 or 4 sessions with either the exosomes or the basis of the Wharton jelly. Yeah.
And the exosomes they're barely used by anybody. This is you're using them. I'm sure there's some other people using them, but that's not standard. Let's say for your average sports medicine doctor, if I were to go in, they're using a different substance that's being put into my knee.
Yeah, steroids. They're going to give you a steroid injection. Most of them, the vast majority at this juncture, are still using steroids, which have been proven by a number of meta-analyses to actually accelerate the development of osteoarthritis. And it's, in my mind, at this juncture, I think we shouldn't be giving steroid injections to anybody except somebody who's in excruciating pain and needs that quick fix, and then move them quickly into a PRP or whatever byproduct of the stem cells we can use to actually correct the inflammation that's in the joint and actually help starting it to repair itself.
I feel like there are people doing what you're doing, maybe not with the exosomes necessarily, but PRP and things of that nature. But I don't know if everybody is doing it the same way. That might be a good thing because you get to document, let's say, a bunch of, like we have 50 states, they're all independent laboratories. We can see how they work out. And we pick the best things. If you have 50 different doctors all using a different sort of exosome PRP ratio, we can see by their patients which one is the best, and then hopefully we can use that. Do you have data, you don't have to give it to us, that you're recording so that you can look back retroactively and be like, this is the dosage and this is the components that I put in that work the most effectively?
So I've evolved it over time. I still use PRP sometimes as an expander, a volume expander, because it's less expensive than the nanoparticle derivatives, and those. But I'm really tending towards using the umbilical cord derivatives much more frequently at this juncture, and they're much easier to use and actually associated with fewer side effects. So for example, when you use a PRP, for example, you take the patient's blood, you spin it down, you get the platelet enriched fraction, and you use that as the injectate. So with the Wharton's jelly, derivative, so an umbilical cord derivative, you don't have to draw the patient's blood, and in fact, the discomfort that's associated with the inflammation after injection of the PRP is virtually voided in those patients that are getting a Wharton's jelly. So and the cost is really not that much more. So I really try and guide people now into one of the better derivatives so that they can get that benefit and not have the discomfort for the next 3 to 7 days after the procedure.
So are you tracking and your dosing, and how is your dosing different? Because I know that the way that you administer, like your approach to administering is different than other physicians, and that's why you get the results that you get. So
Yes.
he does have a different technique. And I think you're right. It's good that people do it differently, but kind of it's annoying because if you get somebody who goes to somebody who does it maybe in a way that doesn't get the outcome that patient could have received, then that patient is walking away feeling like, oh, I tried that and it didn't work. When maybe had they gone over here, they would have had a completely different result. And I think patients don't have the information to ask the questions that they might want to be asking.
And I should clarify, it's only good in the beginning of the process until we figure out who has the best process, and then we just exclusively use that best process. But like you said, we are in the beginning of this, and because of that, some patients are going to say, oh, I did PRP, I got nothing out of it. Well, some doctors shoot nothing in there. They just literally want liquid in there, right? To, like you said, to expand, and maybe that'll help for 6 weeks, but it's not going to help for 6 months. You're going to have to go back in, right? So having a better model like you do with the exosomes seems to be maybe what we're looking at moving forward.
And I think the technique I use is more directed at injecting very specifically the ligaments, the tendons, the intra-articular. I mean, going around the joint and injecting very specifically in those areas and loading those areas up with the injectate and allowing that to go to work. Most people that are doing it that stem from the PM&R and orthopedic domain, I think, are still using a single intra-articular injection, and that's it. And I think that probably could be a result for a more compromised outcome.
I have more of a business-related question here. Is it? Do you find it advantageous or a disadvantage to not have everything covered by insurance? Meaning, if tomorrow I can tell you every single thing that you do is covered by insurance, would you want that, or is that oversight actually sort of a bad thing for your business model?
I hate insurance. And insurance companies are practicing medicine. It's highly inappropriate. They're deciding what a patient should and should not receive, and they're arguing with a physician's medical decision. For example, estradiol or even natural thyroid medicines that we would deem appropriate for a patient. We'll get letters all the time for an insurance company saying this isn't covered. We don't have the data that says that this is what this patient needs.
Or it's not on our formulary.
Not on our formulary. So, I mean, in my happy place, we don't have insurance except for maybe major medical, accidents and things of that nature. I had listened to like Dave Ramsey or somebody talking about insurance as, it was never, like I said, it was never intended to keep you healthy. It was intended to help you in urgent accident, catastrophic situations. That is what insurance was designed for, and we've just completely
allowed it to
manipulated it. Yeah, it's just out of control. I think it's an inappropriate use of power, but that's another podcast probably.
Yeah, well, and unfortunately, the general public, if they are paying for insurance, sometimes they decide, well, that's my cap in how I'm going to treat my health and wellness. So I'm spending X amount of dollars a year, but that's not preventative, right? That's sort of critical care-esque. So they need to step up and say, hey, and I always talk about this, if you're worried about your wealth, you should be worried about your health. You want to save for retirement, you're not going to be able to use that money in retirement. You're not going to be able to take that trip to Italy because you're going to be in a wheelchair. So, spend the money on yourself, go out. It doesn't matter if your insurance covers a procedure like, Dr. Tripp is doing or not. If you have the pain, if you're worried about your long-term health, you have to be worried about preventative care. And I'm glad you guys, do such a good job of that. From, again, I hate this word holistic, because it reminds people of going out in the woods and taking, plants off trees and rubbing them all over themselves. It's not that. It's just that we know that the whole body is interconnected. So, one thing matters, and then everything's interconnected. You make one decision somewhere, there's going to be some repercussions somewhere else. And what are we looking at? I have so many patients who are on, let's say, 10 medications, because once you're on one, you continue to be on more and more and more, but none of them ask how they work, right? So I go to my patients and say, do you know how your cholesterol medication works? They have no idea. They go, it just gets rid of my cholesterol. Oh, that's not exactly how it works. So, it's really good and enlightening and fun to hear that there's people out there with business models like yours who are really looking at the overall health and wellness of their patients and clients.
Yeah. Yeah. I mean, even our team, when you ask our team member what they love about working for us, like everybody here loves to see somebody coming in, compromised, and then watching the evolution of that patient, like their whole disposition and their whole outlook changes. We've seen patients who come in and not only just take the information and apply it to their health, but they start to take the information and they apply it to their relationships. They start to apply it to what they're doing at work. And so all these other aspects of their health, which also impact of their life, which impact our health, are being improved upon. And it's a really exciting, from an observer perspective, it's really exciting to see that kind of transformation taking place.
I think it's a great sort of pitch, though, and an advantage towards you guys to be able to say to a patient, someone like me, say, hey, Steve, not only do we not only have 15 minutes like your average physician does to sit down with you and then I'm out because of this burn and churn insurance related thing, but also I can make the best decision based upon your health, not based upon what the insurance company is going to tell me we can do or not do. I just am looking at the medicine, looking at your body, and making a decision, and we're going to do it. Now, yeah, you might have to, cough up a little bit more dough, but ultimately, this is the best plan for you. I'm not just making a decision based upon what I know the insurance company is going to approve. And if you're somebody who really cares about your health, that's a great pitch. It's a big advantage to me, the consumer.
Yeah, well, that would be our ideal client.
Well, this has been fantastic information. Thank you so much, Dr. Tripp and LeNae. LeNae, why don't you tell us where people can find you specifically, if they want to reach out to you guys, if they have questions, website, Instagram, whatever's best to find you guys.
Yeah, probably the easiest way to reach out is just go to the website, and that is yourinfinitehealth.com. And we have a free discovery call with one of our wellness coordinators that they can sign up for or subscribe to the newsletter, which I'm very inconsistent with, but my heart goes into it every time I actually do it. But again, yourinfinitehealth.com.
LeNae and Dr. Tripp, thank you so much for joining the TrulyFit Podcast.
Thank you so much.
Sir.